what happens when your spouse is working and has employer provided health insurance? You're still working and eligible for Medicare. Well, here to talk with me about that is Jae Oh, author of Maximize Your Medicare. Jae, welcome.
Thanks for having me, Bob.
So I know this is a problem that affects a good many people, and I'm sure you're here to enlighten us.
Especially with so many people working beyond 65, the trend is, growing. It literally goes, a week does not pass that I get asked this question multiple times. So let's just take the large employer and focus on the large employer. That will cover the dominant, although we realize that there's an entirely separate set of questions for small employers. But if if your spouse is the full-time employee at a large employer, and that is defined as 20 full-time employees at your employer, that the spouse can delay Part B without having a late enrollment penalty for either Part B in the future. Separate is if that plan provides prescription drug coverage, which the CMS deems as credible coverage. You can also delay Part D, also without penalty. And the reason that I like this topic so much, Bob, is that many times the employee asks the HR department, can my spouse delay? The spouse double checks. Can I delay? And they get inconsistent answers, which is incredible to me. It is very difficult because they're trying to learn the new language of Medicare. And so they wouldn't know this nuance. And all they hear is, yes, are there late enrollment penalties? They are. They're permanent. They happen continuously as long as you are enrolled in Medicare. So this first checkpoint has to be handled correctly. And also, as you can understand, why I appreciate, one of the many reasons I appreciate you, Bob, is the fact that this type of question is very, very common, irrespective of the audience, meaning that person could be the highly educated, it could be manual labor. It has not mattered. It literally is the same question over and over, even when the human resources point person, if you will, is well-meaning. It is simply a mistake that gets made too frequently, and one that people should be on careful lookout for.
I mean, it's certainly understandable that someone would go to their HR department to get information about benefits per se. What do you, right? But what do you recommend? I mean, obviously, people should read Maximize Your Medicare and sign up and subscribe to your YouTube channel, et cetera, et cetera. They also have the option of going to Medicare.gov. How good is Medicare.gov at explaining what the options are here?
I would say actually Medicare.gov has improved notably. For example, when we first started speaking with each other, either by email or by quotes from that I've contributed, it has improved since then quite a bit. That said, the issue is that that's the federal rule, and then the question becomes the coordination with the actual HR department, because your participation in a large employer plan as the spouse, that enrollment happens with the employer. So as a result, that said, it's impossible, candidly, that a large employer would violate or be inconsistent with the federal rule. That's a federal rule. Every employer that fits the description of large employer has no choice but to follow it. And that also includes then insurance carriers and people like me that represent everyday people when providing Medicare guidance, for sure.
Yeah. Yeah. So, assuming someone gets the right information, the decision whether to stay on the spouse's health insurance plan or to go on Medicare is, I guess, a question of a few things: math related, expenses for Part B, expenses for your health insurance plan at the employer, et cetera, et cetera. What take us through the, I guess, the decision making process as to whether you should stay or go.
So certainly a wide variety of inputs here, Bob, and we don't have time today to cover every last bit. But first of all, of course, the highlight is cost, which is that you could you could not participate as the spouse of a full-time employee and fend for yourself, meaning enroll in Part B, choose Medigap or Medicare Advantage plan. That is complicated by someone's health situation, meaning that, for example, Medicare Advantage or Medigap may actually handle your known healthcare service needs more efficiently. And by efficiently, I mean cheaply, to satisfy access to satisfy access to healthcare providers at a price overall cost which you may find superior. So as a result, everyone is usually just relieved. Oh, thank goodness I don't have a late enrollment penalty. I get it. This is what I'm able to do. And then there's this second layer of questions is what a person should do. And of course, to give you an idea, when I first said about cost, you can understand now the math of money comparison changes. For example, if you're the highly paid person, meaning that the spouse is a highly paid person at the company, your household income is too high, you may incur IRMA, which is the income related adjustment amount, which will depend on your household taxable income. So now the comparison, the math of money comparison, the entire exercise can differ from household to household for either one of those two reasons, either the healthcare services required or your income or a combination. So a complicated set of factors is involved when thinking through what a person should do.
Yeah. So as you're talking, I think it's possible that a person could, on their own, sort of look at option A and option B and come to some sort of conclusion. It might be just as they might well be as well served going to a financial advisor, professional who can be a sounding board for whatever decisions are being made to help them maybe identify things that they haven't thought about, perhaps.
Absolutely, that I would suggest that. Of course, I'm going to be biased on the topic, notably. That said, yes, it can be this case, and the fact is that there can be certain situations where you're just uncertain, meaning that the math of money is almost exactly equal, and which we find a large number of times, in which case the spouse just says, I don't want to deal with the process of switching to Medicare. For example, mid-year, they receive a diagnosis they didn't want to hear. They were only pursuing it for preserving premium, and the premium savings were minimal. They might just say, I don't want to deal with the uncertainty at that time, in which case they may choose to enroll in Medicare right out of the gate as soon as they turn 65, even if they had completely defensible reason to delay enrollment in Part B. These combinations, of course, and the reason I use this example is that is a very personal, private one, where how one spouse may think one thing and then the next door neighbor, a twin. I like to use the comparison of your clone twin may have developed a certain opinion and come up with a very different conclusion.
Yeah. And I think this is the case where if you were to decide to go from your employer provided health insurance to Medicare, it's largely a irrevocable decision. You can't go from Medicare back to the employer health insurance plan. So it's really something you need to contemplate seriously before you make that kind of decision.
In the base case there, Bob, and now you've opened a whole nother set of issues. But yes, absolutely.
That's my job, Jay.
That's right, Bob. Is the fact that company to company, employer to employer, can also have different rules. There's not a rule here, that a federal rule to say once you leave, you cannot return. In fact, I have seen situations where that is possible under certain circumstances.
Well, there's nothing like having certainty around some of the decisions that you're making, and now I learned that there is none on that case.
These are largely private. These are largely private, Bob, is their bottom line. I mean, there again, we have largely spent a lot of time to make the rules clear. Right? Maximize Your Medicare is there to provide clarity about the rules in plain spoken language that everyone can understand. Then again, there are, to me, two extra layers. The second layer is, okay, what should that household do? And then third is, okay, let's cross the finish line, because we then have to, in fact, tie everything into a bow and get you to become a member of the plan that you want, or to secure a Medigap plan at the most efficient price point.
Well, I think, Jay, in essence, we are in the process of helping millions, if not millions, of people who are facing this decision each and every year. So I want to thank you for, as always, sharing your knowledge and wisdom with us.
Thank you, Bob, for helping.